And next, Electrospun polyurethane dextran nanofiber loaded estradiol. Okay, so estradiol, you can cure the cutaneous type of wound. So they loaded the estradiol in polyurethane and dextran to make a soft nanofiber. They observe it shows more than 90% of wound closure within 21 days when compared with the control group. Okay, and also it shows the sustained release, the drug release up to 200 hours. Okay, and next, another nano formulation which is contained epidermal growth factor and aloe vera. We all know about the aloe vera. It shows the good wound healing property, and epidermal growth factor also is actually shows the wound healing property. Okay, the loaded recombinant epidermal growth factor and aloe vera in PLGA nanofiber. When observe the wound healing activity, it shows the enhance the re-epithelialization process when compared with the other control group. Okay, and this is also shows the sustained release formulation. They observe 7 days the drugs released from the formulation. And next, honey chitosan nanofiber, wound dressing with the allium sativum and cleome. So allium sativum, it's a potent antioxidant property. Okay, so honey, traditionally we are using honey for the wound healing property, and chitosan also shows the antibacterial and wound healing property. So they loaded this extract in the chitosan polymer, and they made the nanofiber, and they observed the wound healing property. Okay, so it shows very good wound healing property when compared with the aqueous cell. Is a commercially available management for the wound. Okay, so this actually is enhance the wound closure rate when compared with the control group. Okay, so as I said, for nanofiber, you can able to load any type of drug. If you want to load any extract, you are preparing any extract, yes, you can able to load, you can able to make a nanofiber. Or if you are isolating any compound, okay, that isolated compound also you can incorporate it in the polymer, you can able to make a nanofiber. Okay, so the research is showing actually vitamin A loaded nanofiber, they observe the angiogenesis process, and vitamin C also accelerate the wound healing, and vitamin E loaded nanofiber also reduce the free radical ions in the wound healing process. Okay, so we see how to prepare, because we are in my lab. Actually, we have the electrospinning machines. Okay, we are doing some research on the electrospinning nanofiber. For preparation of the solution, first you need to prepare polymer. Okay, as I said, first you need to take a polymer. You need to select what polymer you are going to do. Okay, so you need to select the polymer and need to dissolve in the suitable solvent. That is the first step. Okay, and next you need to take a drugs. Okay, so the drug should be dissolved in the suitable solvent. Okay, and next you need to dissolve the polymer into the drug solution. Okay, once you dissolve completely, then you can take the solution by using a syringe. Okay, so first you need to do this one, and next once you have prepared the solution, and you need to set in the electrospinning apparatus. Okay, so this is the apparatus. Actually, it is available in our lab. Okay, so you can see the voltage regulator. Okay, so this regulator can giving the current supply to the syringe. Okay, the second is the syringe pump. Okay, in the syringe pump, we need to fix the syringe. Okay, after that, we need to set some parameter. So what is the flow rate of your solution? What is your size of your syringe? And what is your targeted drug or targeted solution to be eject from the needle? So these three things you need to feed in the syringe pump. Okay, and next you need to fix the electrode in the needle. Okay, and next is the collector region. Okay, there are two different type of collection method is there. This one is the rotating collector. If you are using the rotating collector, okay, you can able to make a nanofiber like a sheet-like fiber. If you are using static method means just you are keeping one divider in front of the collector region, rotating drum. Okay, so this nanofiber will be collect in only particular one area only. It cannot able to make like a sheet. Okay, by using static method, you cannot make like a sheet like, but by rotating drum, you can make a sheet like appearance of nanofiber. Okay, so this is the speed controller. This speed controller can able to regulate the speed of the collector. Okay, so now before we start the making nanofiber, so you need to do all the setup first. Okay, and next you need to try with the different voltage, because we cannot say what voltage, okay, what distance and what speed it can able to make a nanofiber. Okay, we need to standardize. Okay, we need to do so many trial. After that only you can able to make a nanofiber. Okay, so you can see here there is a white color sheet, right? Okay, so from the white color sheet we are pulling the nanofiber here. Okay, as I said, in the collector region, first we tried with aluminum foil. Because of very thin layer of the nanofiber, we couldn't able to peel the nanofiber from the aluminum foil. Then we decided to use a baking paper. The white color is a baking paper. Okay, so in the baking paper, yes, the nanofiber can deposit on the baking paper. Then easily we can able to pull from the baking paper. Okay, so this is the setup, actually standardized parameter we done by using a PVA solution. Okay, so speed we set 100 RPM. The needle size is 21. We used voltage 10.2, PVA solution 4%. The distance between the needle and collector region 10 centimeter. The injection rate will set 1 ml per hour. By using this parameter, yes, we got a nanofiber, good nanofiber with a nano size. Okay, so and then later actually we decided to apply on the wound. Okay, so we got a good result. More than 95% of wound closure we observed in 21 days. Okay, so this is the new era of wound therapy. You can see here look like a gun, right? Okay, this is called as the nanomedic gun. So by using this gun, we can able to spray the nanofiber. This is available in the Israel. Soon it's going to available in India also. This is the first total therapy solution with the Electrospun healing fiber for wound healing and skin regeneration. Okay, so this is a one-time application. Excellent healing they observe. No painful during redressing, and it's that layer is a transparent layer, so easily can able to monitor the wound. Also, it reduces the risk infection and cost effective when compared with the currently available marketed product. Okay, but there's some challenges we observed during making a nanofiber. Now we actually is a lab scale we produced. The upscaling of nanofiber production is a big challenges. Also the solvent. Sometimes we are using a solvent, it will be not be toxic. That is the other major concern we faced when you are making a nanofiber. Okay, so now when you see the growth of making a nanofiber is keep on increasing. Nowadays, the researcher shows that tremendous interest in the development of the nanofiber, especially by using the electrospinning technology. You can see the publication. Okay, so you can see in 2021, it shows the very good publications when compared with the previous year. So the interest of on nanofiber, making a nanofiber is keep on increasing. Okay, so now actually in India, some university they are doing this type of electrospinning nanofiber. Okay, if you want to do if you are very interested to do the nanofiber, yes, you can collaborate with those university. Okay, IIT Kharagpur and Anna University and IIT Chennai, okay, and CLRI and SRM University. Okay, so if really you are interested, you want to do wound healing, especially you want to see the advancement in the wound healing management, you want to make a nanofiber, sure you can able to collaborate with this university, you can able to do the nanofiber. Okay, so nanofiber, definitely this will be shows the significant role in the management of wound in the future. Thank you all.
Thank you, ma'am. Thank you for this wonderful presentations. This is like a high-class teaching of nanofiber, how to make a nanofibers. This is I feel that while I'm doing my M.Tech, I hear this type of presentations. Now I'm back with the from you. That's really very beautiful presentations. We are very happy, and I think everybody will clearly knows that how to make a nanofiber. That is very beautiful, ma'am. Ma'am, now I have one question.
Okay,
that you kindly share your journey in research.
Actually, sir, I have research experience around 10 years. Usually, I focus on wound healing property. But one day I decided, because every time when I do the research, I prepare a extract or isolated the compound, then I will study the wound healing. But one day I was thinking, why we are doing repeatedly the same thing? Then I decided to make a nanofiber. I go through the literature. Okay, according to the literature, now the demand is growing. We can observe with the nanofiber. That's why actually we decided to make a nanofiber. For the past 1 year, actually we are making this type of nanofiber. But when I started this nanofiber, you cannot believe that actually I first 2 months I didn't get any nanofiber. Well, only the solutions will be deposited in the collector region. I didn't get any nanofiber. I was keep on trying for 2 months. After 2 months only, I can see the nanofiber in the collector region. That day, actually, I was very happy.
Super, ma'am. Super. And next question is, ma'am, if the nanofiber is only used as a transdermal one, otherwise you can use as a treatment for cancer in colon and vaginal or some other parts. Can we deliver the nanofibers to the inner organ?
Yes, of course. Possible? Of course, so many researchers are doing with the actually nanofiber. Orally they are giving, and they are observe the anti-diabetic activities also. Definitely we can do systematically also, we can able to give and we can observe.
If there is any side effects due to the polymer presence in the fiber?
No, that's why actually when we select, we need to select the unique property of nanofiber. It should be biodegradable and biocompatible. Non-toxic polymer we need to select. If you are selecting any toxic polymer, definitely that will be causes the toxicity.
Thank you, ma'am. Thank you for these wonderful answers. And participant, this is your time. You can ask questions to ma'am. For if anyone like to ask question, kindly ask to Dr. Sasikala, ma'am. Yeah, Sangeeta Jayasankar, now you ask your question.
Ma'am?
Yes.
Ma'am, yes, apart Sangeeta, from the wound healing, this nanofiber can prevent or cure the scares of the burn victims, ma'am.
I couldn't get you, Sangeeta.
Ma'am, by using of this nanofiber, we can prevent or cure the scares of the burn victims.
Scares?
Yes, ma'am.
Yes, of course. You see, whenever we are using nanofiber, normally, when you see the wound management, there will be the scar, right? Okay, scar we can see, and overgrowth of skin also you can see in the particular region. But when you are making a nanofiber, definitely we can able to cure the wound without any scar.
Thank you, ma'am.
Okay.
Soundarya, now you can ask the question.
Thank you, ma'am. Thank you for wonderful occasion with us.
Thank you,
ma'am. I have a doubt. Is that what is the cost of this nanofiber after you commercialized?
Actually, when now we are renting the instrument, okay. So when I renting the instrument, I'm spending 20,000 for 3 months. Okay, but when I search in India, the cost of electrospinning machine is actually around 4 to 5 lakhs. So there won't be any much cost for preparation of any nanofibers, because you are going to make only the polymer, and your drug's choice of drug depends upon the cost of choice of drug. Okay, so once you bought an electrospinning machine, after that it will be cost effective. The machine only, it's the cost of machine only. Once you bought that machine, then you can able to make a nanofiber with a less cost.
Okay, ma'am. Thank you, ma'am.
If anyone like to ask questions to Dr. Sasikala ma'am, kindly raise your hands. Ma'am, I have one question, ma'am.
Tell me, Doctor.
Which size of nanofiber will give the efficient activity in the human?
Actually, if you are getting 100 nanometer size, that will be very good. But it's very difficult to make 100 nanometer size of nanofiber. Actually, we got actually 500 nanometer nanofiber. But if you try to get 100 nanometer, that will be very good.
Thank you, ma'am. If anyone like to ask question to Dr. Sasikala ma'am, kindly raise your hands. Okay, Soundarya, now you can ask the question.
Ma'am, you said that you got the size of the nanofiber is 300 nanometer. How to reduce that nanometer to 100?
Yes, that's very good.
How to reduce the size?
Very good question, actually. This is depends upon the size of needle what we are selecting, and how much the distance we are keeping the needle and collector region. This should be far away. If you are keeping far away, and if you are using the size of the needle is very small, then you can make a very minute, very less size of the nanofiber. These two parameters will be contribute.
Okay, ma'am. Thank you, ma'am.
Ma'am, one more question, and this will be the last question, ma'am.
It's okay, Doctor.
In the section. So what is the difference between the nanoparticles and nanofibers?
So both, yes, both are actually same. Nanoparticle and nanofibers are both are nano size only, but the structurally it is different. As I said, nanofibers are look like a fiber type with a porous nature and look like an extracellular matrix. It's like a fiber, but the nanoparticle is a particle. Is like a particle, not like a fiber type of structure. But both are nano size only. The structurally it is different.
Thank you, ma'am. Thank you for the wonderful answers, and thank you for these presentations. Once again, I really very respectable to you for this presence in BioYojana 2021 organized by Tanbay R&D Solution, and giving this enlightening topic to us. Thank you once again, ma'am, for your presence here.
Thank you, Dr. Purushothaman and Dr. Soundarya. Thank you for this opportunity. Thank you.
Thank you, ma'am. Soundarya, now you can give the vote of thanks to the ma'am.
Thank you very much, ma'am, for sharing your profound knowledge with us. Your session was full of valuable information with wound healing properties in nanofibers. Thank you so much, ma'am.
Thank you, Doctor.